The goal of this review was to better understand these concerns, to understand how the prescribed safer supply program was actually being used in the province, and to make recommendations to government about continuation or not of the program, and how would we better support people who use drugs and clinicians. So the process that we undertook was a series of listening sessions, and quite broadly across the province, we talked to clinicians, so that's doctors, physicians, nurses, nurse practitioners, and pharmacists. And when I talk about physicians, we had a broad spectrum of people who were addictions medicine specialists who worked on the front lines. We talked to psychiatrists, pediatricians, family doctors, public health specialists, emergency physicians, hospitalists, people who worked with corrections, so a whole variety of clinicians across the province who had various degrees of interaction with this program. We talked to nurse and nurse practitioners, to pharmacists. We talked to people in different geographic areas, so clinicians who worked in the downtown east side, who were experiencing and had very specific needs and concerns. We talked to people who worked in urban areas outside of the downtown east side, in rural areas, First Nations communities who supported people in First Nations communities, and small and medium centers. We also had a number of listening sessions and discussions with people who use drugs themselves, people with lived and living experiences, their family members and supporters across the province, and additionally met with a number of academics and researchers in BC, across Canada, and internationally. And when I took on this review, I committed to making the results public, partly for transparency so that people understood what we heard and where the recommendations that I made come from, but so you can hear and understand as well the wide range of experiences that people have had with this program. So the review was aimed to understand the challenges faced by people who prescribed safer supply, by people who access or tried to access the program, and as well, and importantly, to understand the broader societal impacts of the current policy and programs, and advice on whether the policy should be continued, and if so, and very importantly, how do we improve and maximize the benefits and minimize any potential harms. In the report, which is now posted publicly, and I encourage people to have a look at that, there are 4 parts to it. One is the report that I've done, the recommendations. A second part of it is an engagement report, basically what we heard, and that is the stories and the voices of the clinicians, people who use drugs, their family and supporters. And as you can tell from that report, there are very important stories and voices there, and they are varied. There were many things that we heard from many different groups of people, and there was not one unified voice around this program. There was, in many places, some conflict between different groups of clinicians as well. There's an evidence scan included in the report, and that was conducted primarily by the BC Centre on Substance Use, and Dr. Crabtree is going to speak to what some of the key highlights from that. And there was an ethics review from a public health perspective, and that's very important. How we look at things from a population basis is quite different from the questions that we as clinicians have when we talk to an individual. We look at benefits and harms accruing to an individual, and we have Dr. Virani to talk to that. I just want to situate as well, when we took on this review, the recommendations that came out of this support what I believe and what I am wedded to, which is a public health approach. And what does that mean? That means we attempt as best we can to respect the autonomy and right to self-determination of people who use drugs. We want to support healthcare providers and others who care for people who use drugs. And we need to address the underlying determinants of health. Things like stigma and shame, discrimination and racism, particularly, that lead to health inequities experienced by people who use drugs. It also needs to be informed by people with lived and living experience and be, as I call it, pragmatic and evidence-based. And I'm just going to talk about that for a minute. That really is acknowledging that we have imperfect scientific evidence. But evidence alone, and you've heard me say this many times during the pandemic, evidence alone never tells you what to do. It has to be put in the context and understanding of what's happening in the community and in the areas around the evidence. So to guide decision making, we can't rely on evidence alone. We have to be pragmatic as well, bridging that gap when there is not sure scientific evidence, and the gap between that and practical application. And again, focusing on minimizing harms and maximizing benefits of any decision that we make. So what that means is that we use evidence to inform the decision, and we consider a wide range of evidence sources, from research studies, which are important, from systematic reviews, local data, understanding what's happening in local areas, the professional experience that we heard from people across the province, but also taking into account the knowledge base that we hear from First Nations, Métis and Inuit communities in this province, and the wisdom that comes from Indigenous knowledge. Linked people from understanding the evidence from lived and living experience, and from a broad stakeholder perspective. And all of this informs the decision making and shapes the recommendations that are in my report.